South Africa's Health Products Regulatory Authority confirmed this week it's evaluating medical records of 28 people who died after receiving a COVID-19 vaccine. There have been no direct links at this stage between the deaths and the vaccines being administered in the country, but deaths and reports of adverse effects have to be reported and investigated by the authorities. The Health Department says more than 6 million vaccine doses have now been administered in South Africa. Let's discuss vaccine safety with Professor Mosa Moshabela with the University of KwaZulu Natal. Joining us from there, I believe, Prof, this afternoon. Always a pleasure to speak to you. So when is it safest to line up for a COVID-19 jab?
Greetings to Megile and to the viewers. I think overall, as much as possible, it is, people must line up for the COVID jab anytime, because then we never know when we get exposed to COVID-19 infections, the virus itself. And what we do know is that it's really unpredictable when one gets COVID-19, and it's better to avoid infection and avoid any complications or death that may arise from COVID-19. However, having said that, I think that, COVID-19 has been really interesting because it was affecting negatively people who generally are sort of not well, medically. People with chronic infections, people who are chronic disease, people who are older, people with comorbidities. And so you can't really say that you wait until you're well to get COVID-19, because whatever condition you're having in itself, before you get COVID-19 vaccine, because whatever condition you have in itself can actually expose you to COVID-19 or expose you to severe disease from COVID-19. But having said that, I think it's important that for anyone who is unwell from general chronic conditions, it's important that they visit a doctor or a healthcare worker. Make sure that their conditions are stable and controlled, and they can get specific advice based on their medical conditions as to whether they are ready for vaccine. I do think that people who have COVID-19 symptoms or have been exposed, say they are contacts of people with COVID-19, they need to quarantine or isolate in order to make sure that the COVID-19 itself is managed. And then, as policy advises, is that after their symptoms have resolved, they can wait 30 days before they then go for a COVID-19 vaccine.
And that was the other question I was going to ask you. A lot of people who are either in the last stages of COVID-19 illness, recovering at home, have been asking when is it the appropriate time to go back to get a vaccination. A friend of mine who's actually just recovered from COVID was saying that he actually needs, his doctors advised him that he needs to come in for a full checkup, I think, with a pulmonologist in order to make that determination. So I guess it's also wise to check with a doctor, a physician, to see if you are in the right condition physically to go back.
Yeah, and this is important, Tembekile, because I think that, when you are well, it's a relatively easier decision. And also when you go for screening and they don't pick up any problems, that's okay. It's not a problem. And even if you find out later that perhaps you may have been exposed to COVID-19, you would not have known. So that's acceptable. But I think what's important is to make sure that people who have, say, symptoms or who know that they've been exposed, they can disclose with healthcare workers so that they can be advised appropriately. And for people who generally know that they've got chronic conditions, there's a lot of people, for example, who have been asking questions because they've got autoimmune diseases and they've got allergies, they've got various conditions that are unique to them, and they don't know exactly how they would react when they get vaccinated. And the advice here is to make sure that, their condition is assessed by an informed medical practitioner who can then advise them specifically for their situation, so that they can know perhaps, the possible interactions of their medical condition with the various vaccines, depending on what kind of side effect profile those vaccines may have. And it's important for healthcare workers also to recognize that for each person, even though they're seeing hundreds of people, that for each person, that person may have unique needs, and pay attention to their needs.
And in terms of what SAHPRA, the Health Products Regulatory Authority, is doing now, as I was saying, coming into our conversation, they're looking at the records of 28 people who are said to have died after being vaccinated for COVID-19 to see if there is a direct link between the vaccination itself and their death. How easy is that to do or to determine scientifically?
Yeah, I think, Tembekile, for cases that have already been submitted to SAHPRA, there is a lot that they can work with based on the medical records. If those patients have visited healthcare workers and have a record, a lot can be achieved from that. Ideally, the reports need to come in before burial, so that if there's a need for a post-mortem, that can also be done. But you may find that for a lot of these reports, they come in when people have already been buried. But also, I think the biggest challenge, and I think once you've got the records, you've got the post-mortem report, making that determination is possible, because you have to consider the clinical presentations, the history, and so forth, and then you can compare it with the side effect profile of the vaccine that are known. The issue might be when, for example, you're dealing with a type of adverse event of a vaccine that may be so rare that it's not yet known. So that requires for several cases to be presented before these side effects can then be documented. And a good example, for example, is the issue of how we identified the clots with Johnson & Johnson. Mm-hmm. We had to wait for like 6 million people to be vaccinated before we knew. And the same thing with the myocarditis for the mRNA vaccines, and also the Guillain-Barré for Johnson & Johnson. We had to wait for so many people to be vaccinated, because these adverse events are so rare. You only have 3 events in 1 million people, or for the clots, you've got 8 events in 1 million people. So they're so rare that it's difficult to actually pick them up easily. But if they are known, those side effects, and the clinical picture in the records and the history shows that it's in keeping, then that's relatively easy to connect.
And that's why they are listed as saying, Prof, to the possible side effects that were warned of when you go and receive a vaccine. And also important, as far as the conversation, let's park death for a moment and talk about people who do have adverse effects. It's important to report these to health practitioners, because government, as things stand, is meant to have set up a platform for which people can claim compensation for medical bills and the rest of it resulting from a vaccine reaction, right?
Absolutely. And this is what I wanted to say next, Tembekile, is that the challenge that we're going to have is for people who experienced any symptoms or adverse events following vaccination and they have not reported. And this, for me, I think it's a gap, because government has really taken long to announce the procedures for the whatever they call no-fault compensation scheme or fund. I don't like the word no-fault, but the compensation fund that they basically gazetted. They need to have made public by now the procedures for reporting, because it's going to be so difficult to go back and trace people who may have experienced symptoms and did not get a chance to report, because these procedures have not been made public. And I was hoping that in the briefing yesterday they can outline or at least announce an update. I think there's a duty on the side of government as soon as possible to really announce the procedures, even if it's just an update, so that people can report. At least the records are in the system, the records can be traced. But it's still possible. For example, Nicholas Christ mentioned that it's possible to connect the ID number of people who have been vaccinated with the ID number based on hospitalization in the database for hospitalization. But for those who were at home and they never reported to a healthcare worker, we are not going to know, and that, I think, is an injustice.
Professor Mosa Moshabela from the University of KwaZulu Natal, always a pleasure to chat to you, sir. Thank you.